Welcome to the RAISEUP Podcast with your hosts, Charlie and Athena Grimm.
Hi, good morning, guys.
Welcome back to the RAISEUP Podcast.
Hey, we got Brian here with us.
Yes, so we have been, like some of you might have noticed, that we've been on this journey of traveling all around, and we are joined by Brian Ritchie, who is the leader of the Alaska Medical Transport organization. And we're excited to not only welcome him here, but then also maybe Charlie could share some of his little stories that we got to see along the way while we were in Egypt and Thailand in between that. So thank you for joining us, and thank you, Brian, for taking some time out. And this is our new series called Leadership in Action. And we're just really looking to hear from you, Brian, like, what do you think of when you hear, like, what is leadership in action to you? And we're just going to kind of open it up from there.
Sounds good.
Well, I mean, Brian, you coming on now, almost a year here now, and the leadership you can definitely see has changed quite a bit here. What do you think? I mean, what's your thoughts?
I think it is different from any other organization I've ever been in, just because it's much smaller than a lot of places I've been. My military background in large organizations like International Source, or it's not something that I've ever really worked with, but it's unique in that aspect. But also, there's a lot of similarities to other organizations. You still have different personalities and different leadership styles and different levels of leadership. So, but I think it's been exciting so far and really enjoyable.
Yeah, well, I mean, you've made a huge difference so far in our organization. I can totally see the difference in the way that you run things, in your personality, and how you are with other people on the team. It's been a real good lift. So.
Yes, and that's something interesting to note, that your experience, actually, it's like state and local government stuff, and federal government. And so that's always interesting for us to see other perspectives from different corners.
Not a lot of private people that you worked for the most part. I mean, everybody.
Only private. With International Source, which is a private company, and then I worked at Ritchie Regional Medical Center, so that was a community health systems company, private company.
But bigger companies. I mean, much bigger. Yeah.
Even
in our heyday.
Yeah, I think the only private company was the grocery store, mom and pop grocery store I worked at in high school. So.
Sure. So, yeah, lots of dynamics in our company, having lots of different revenue flows and different things between EMS and then doing transportation, and then crew transportation, medical transportation, tourism, baggage claim delivery. I mean, it's short-term rentals. I mean, we have lots of different ways in going inside there. So it's nice to see the different management skills that we have between our different team leaders, and then we bring that all within one. I mean, like under our whole umbrella of companies, we kind of take bits and pieces from each one of that and kind of put it together in our companies.
And what I noticed there is just the collaboration, right?
Yeah.
I think is really, really good. Everything from the CSAs to the dispatchers to the administrative staff over here on the second floor. That everybody works well together. It's a small, tight-knit group, and everybody has to kind of step out of their lane to make the mission happen. But we all work really well together, and that is really enjoyable to me.
Yeah, I mean, Brian, it just doesn't help on the EMS side. He's helped us on the driving side. He's helped with the crew transportation. I mean, all of our managers help in the same roles, helping everybody else. They have their kind of key niche area, but we are all willing to jump in and go help everybody else too. So that's from us even to washing cars, to delivering bags, to whatever the mission is critical, we get it done. So.
Well, and I think it's a demonstration of really what service looks like. It's like we're in service to the whole group. It's not I don't do that. And it's not coming from a place of, oh, we have to do all of this to make it work because this is crazy going on. It's more like, hey, there's unexpected things that come up, and we have a decision to make in those moments. And sometimes it's a split decision. And that even better. We get that call in the middle of the night, and you've got to decide, are we taking that run? And it's like, thinking about just your role as part of the leadership team here, like what have you noticed in particular about some of those decisions that you've had to make that have been it's mattered. It's mattered for the patient. It's mattered for the team member. Like, I feel like if anything, you have this very unique spot because you're in patient care.
Yeah, and I approach it from an attitude of work to yes, right? So we work to solve that problem. You know, a problem comes at us, whether it be, you know, like a plane divert, right, on the transportation side, or like you mentioned, that call in the middle of the night, patient is at a hospital that's critical, that may not necessarily fit what we do on a daily basis, but how do we get to yes? How do we get to the best possible outcome for that patient, and to transport them safely? So, you know, using all of your resources, and maybe it's reaching out to Charlie and saying, you know, can we do this to get to this point, right? And always working yes, never having that first answer is no, right? You know, really doing that critical thinking and thinking a lot of times outside the box to get things done. And I think, you know, Charlie's a great example of that, right? You know, we get a pre-divert in the middle of the night, and I know things are scrambling, and I come in the morning and people are running all over the place, and I get to ask, hey, can you drive a van? So it's that type of mentality that everybody's pitching in, and we all work to get the job done.
Yes.
You know, I think we get those phone calls at nighttime too. Like you said, Seward. I mean, we get sometimes patient phone calls that maybe are a little bit out of our scope, but within our scope, but we don't do all the time. And then, you know, sometimes I'll have to ask Brian if I'm the manager on duty or something like that and say, Brian, is this really something we should be taking or not? And then it even goes as far as sometimes us calling our doctors and saying, hey, is this a real viable patient we should do? They're in a setting now, it's controlled. We take them out of that, it's an uncontrolled, and then we're in the back of an AMBO, which doesn't have near as many resources or hands as it does in a hospital. But sometimes the hospital just can't handle it, and if we don't go, something's going to happen, and not a good outcome. So there's always, I feel like there's something that we have to weigh on between our team, between us, between the patient, between the hospital. It's like, and there's a lot of times I want to say that we've declined the call. Because we've,
Sometimes the answer is no.
100%, and we hate to say no, but we've gone through all the different lengths of how we can get
and then
past
the follow-on to that is helping the other, helping the hospital get to that next solution,
Yes.
right?
Yes.
We know we can't get there in time, but, you know, one of the air care companies can get there with a helicopter or a plane in a timely manner to make sure that, you know, we can all work out the best solution for it.
And, you know, we have done that, you know, with LifeMed and Guardian and the other partners that we have in the air medical fields. They're really good to work with, too. I mean, I remember sitting down there and we had a patient transport to Seward, and I was on it, and we stopped by the hospital, and they still had a critical patient that was waiting there, and the helo was on the ground. They just couldn't get out. So at the point, if it was going to wait another 10 more minutes, their critical team was going to get in the back with our paramedic and ride back because this patient definitely had to go. Yeah. But they had a 5-minute window, so we all loaded up that patient like fast as possible, and us helping them load him into that thing, and he had just a 5-minute window to get out of there, and they made it safe back into Anchorage. So I mean, that's sometimes everybody working together is really helpful in that.
Yeah, and a lot of that putting your ego aside, right?
And
just saying we need to do what's best for the patient and do what's best to get the job done, and that may not be us doing that, right? It may be helping somebody else do that.
Yes.
But the benefit, I think, is helping on the other side of it. In us in the EMS world, we always want to help. I mean, money is always nice too when it comes with it, but sometimes just doing the right thing is the right thing. And I think that's something that we all understand. Even like, you know, we had some family members that flew in the other day, and I called over to Guardian and talked to them, and it's like, hey, do you think we could take this call? It's a family member that's flying in town. 100%, Charlie. They had a ambo on the ground sitting there. But
we wouldn't have been able to do that if we didn't have such a good relationship with our partners.
Yes, and I agree. You know, that was just us calling Andrew or calling one of those over, creating Grace over at LifeMed, and just saying, hey, this is what we have going on. But that's the same thing I think them calling us too, is they know that they can call us and say, hey, I'm not going to have any ambos on today. Can you pull an extra ambo on for us today, because we have a lot of life flights coming in. So the relationship of us just being able to call each other, even though we're in competition with each other a little bit, but it's friendly. It's good. We help each other. Even us leaning out and worth of them and saying, listen, if you don't have another ambo crew and you have too heavy of a patient, call us. We'll come out and help you guys. So we set that up with them and the dispatches. So we had somebody else because Anchorage Fire Department has a different mission. They're on the 911 side, so we don't have them sometimes to call when you get a 400-pound patient, or we get a patient that's a little bit an odd area, and it takes more than the 2 people that we have to dispatch it, or our second crew. It might take a 3rd crew. So
even though it took 7 firefighters to transport that patient to the hospital,
7 rigs. It was probably like 12, 14 firefighters.
So it's like, how many of you did it take? Well, 7. Well, then how did you think one ambulance was going to do that?
It kind of reminds me of us as troopers. Like we go out solo and we take care of it, like the troopers do, and then APD needs 5 cop cars to go to one call because that's what the protocol is. So protocol says they have to do that. What we kind of improvise and just make things happen, and when we can't, then we call for some help, and it's not very often. And you and I both jump on calls to go help. I mean, we'll hear that there's somebody that's a little bit larger, or someday it's going to be a little bit odd, and you'll still put yourself in service. I'll call you. I'm like, hey, do you need another rig? And you're like, yeah. So we'll all meet up there. But that's the thing I really love about it. It's like nobody says, well, why don't you guys handle it? I mean, we just take care of it because they asked. I mean, if they're asking, they need it. And our teams they don't ask unless they really need it.
Yeah.
So,
for sure.
And I appreciate that about the team too, is because they don't try to get themselves over their head.
Yeah.
Like they look at it and say, look, this is going to be a problem.
Yeah.
So before we take them away from that area that is a good, secure, safe environment, sometimes we've had to go to the hospital and just say, listen, we're not going to be able to get this person home.
Yeah, for sure.
And sometimes the hospital staff doesn't understand it, but where they have a complete hospital lift team, and they have a team to do this, and they have a team to do that. When we get called at 2:00 in the morning, it's 2 of us, and it's taking somebody sometimes 425 pounds to a 2nd-story floor to lift him up from there to put him up in his bed. And God bless these people. We want to help them as best as possible, but sometimes we just don't have that resource, and we have to get more help or reschedule them at a time that we'd have more help.
Yeah, and something that I'm curious about is working for these other organizations where you said it was just a little different. And I'm curious, how do you balance? Like, I know there are some things that being in a smaller business, like Alaska Medical Transport, we can make quick decisions. How did you grow your patients to allow bureaucracy to slow down the process? What advice could you give somebody who maybe hasn't or was getting ready to make the jump into an entrepreneurship role, and they're in that situation, or there's a professional that's in the situation who's really in that season of, oh my gosh, can we just pull the trigger on this?
Yeah, I think, from a perspective of a large organization or a government organization, they have their processes in place just because they're so large, right? And it comes down to the processes. They are frustrating, right? The bureaucracy is frustrating, but it's there for a reason, just because they're so big, right? If you look at a government organization, all their funding is allocated based on the legislature, right? Whether it be state or federal, that funding is supposed to go to a certain place. So you can't. It's not like us where you say, okay, we want to buy something, let's just buy it. You tell me all the time, well, let's just put it on your Amex. That's not an option in a bigger agency, because they need to know where that money's coming from, what funding line that's coming from, what pot of money that's coming from, before they can make sure it gets allocated. Because if you steal money from one funding line, then that may have been allocated to something else, then you don't get the thing that it was protected for, right? So if we're protected by a new ambulance in 5 years, but I'm stealing money, figuratively, right, from that pot of money to buy a new ventilator, well, then I can't buy an ambulance in 5 years. And the ambulance fleet that I have starts degrading, and then I can't, and then the whole system breaks down, right? So it is frustrating, but I understand the background behind it. And it took a long time, right? So 24 years in the military, I didn't really understand it until I was about 20 years in. So I fully understand why we did what we did, but it makes sense now, and it works for the larger organization. I couldn't imagine a large organization to be able to do the things that we do in the flexibility. And that gives us an advantage, right? So, if we need to do something right here and right now, we have the flexibility to do that, whereas a bigger organization, they just can't, and it makes sense for them, right? So it is tough to be patient, but if you understand the why on why it happens, then that, I think, helps a little bit, not always, but it does help a little bit.
Well, I can imagine. I mean, you have so many different people that have hands in the pot that there could be theft, there could be all kinds of things, or giving out discount deals to other people and stuff like that too. The one thing I really saw when Mike Crotty was here is that he would see grants for like new laptops, but he'd have to put all these proposals together and then he'd have to put them out to bid, and it would be like coming down to the end of 2 years, he was still trying to make it happen so he didn't lose that funding for it. And it was just so frustrating. And I remember him asking, he's like, hey, we need to buy some stuff. I'm like, yeah, let's go buy it. And he's like, well, do I need to put an RFP in it? And I'm like, no, just go buy it. And he's like, really? Just go and purchase it? I'm like, yeah.
He was so happy that.
Yeah, he was just like, he's like, oh my God. He goes, I just not knowing it. And me not being in a militant area like that. I mean, even when I was on the Girdwood Board of Directors for Girdwood Fire Department, I mean, we had allocated funds. We had earmarked funds that we took out pretty much for what it was. And if we needed something, we could usually find some extra slush funds that are somewhere and be able to put that towards it. But again, when you're going for tenders or engines or something, it went out for RFPs. And, sometimes you'd always want to pierce, but you'd end up with something else because, it was a cheaper bidder it came in. And, so it's just, you never knew what you were getting. You could put some specs, what you wanted, but you didn't know what manufacturer was going to make it. If you're going to get a Ford, a Dodge, a Chevy, an ambulances, it's whoever came out with that best bid. So sometimes you're just like, ugh.
Yeah, and a lot of that is due to, either taxpayer, because taxpayers are funding that bill, or investors, right? So you want to get the best price for your investor or your taxpayer.
Sure.
So that's a lot of the why behind that. And at the operator level, you don't think that far a lot of times, and you say, well, I need this now. Why can't I get it if we have money for it? But if that money's not allocated for that, then you can't do it.
Yeah.
So,
yeah, and I think that's the difference between when you're in the management system and all the way up in the higher ranks of where you're at than you are just the person that's on the line, seeing that you have all this cash flow, seeing inside this line, and why can't I get a new rig? Because they just have no idea what the processes are and procedures are and getting that. Yeah.
And I think my role was always to help convey that to them.
Yes.
May not always come across well, but and that was one of the things I always tried to give them the why.
And I think we've been very good with our teams. I mean, we don't usually go without. We have a lot of good systems, a lot of good inventory. We have a lot of good rigs. We've been very blessed not to have a lot of older stuff. And we've been then really with the training and everything else we've been getting, it's been nice. I mean, it's been nice to be one of those leaders in that side of it, especially now we're just 5 years into this. It's it doesn't even seem like it's been that long, 5 years. Yeah, just over 4.5, 5 years. So yeah, it's come a long ways. Yeah. Last month, how many calls did we end up having? Like 211, I think. 211 calls. Yeah, that's a lot for a private ambulance.
Yeah,
I mean, that's
266 in August.
Yeah.
That was a record month for us.
Yeah. Shoot, I think Girdwood only has like 400.
I mean, have you ever sat and thought like 266 transports? Like I had a hand in 266 transports.
Yeah, I don't. I probably should, really, because you're impacting 266 lives, right? And it may be simple, maybe just taking somebody home, but I think, the ones that impact me the most are the ones I'm physically involved with.
Right.
Taking the patient home on a hospice, right? So they can die peacefully in their own home and with dignity and be around family members. That's huge, right? That's a huge impact on their lives. I'm not saving their life, right? I'm not doing all these advanced measures. I'm simply letting them go home with dignity and be around the family members and meet their wishes and meet their needs, right? And that's, to me, just as impactful as running a 911 call or with a major trauma, right? So it's different, but it's really impactful.
And I look at this line of work and you being a paramedic yourself, it's like that is more about helping them regulate and stay calm because they want to go home. They just want to relax. They just want to be in their environment. And that is medicine.
Yeah.
If you really look at it, I don't think anybody wants to die in a hospital. I mean, and I think like the dentist chair, everybody hates going to the dentist. Everybody hates going to the hospital.
You like your dentist.
I do like my dentist, but I hate going. But again, I think it's just the fear that we have of pain or whatever's going to happen. And there's usually not a lot of positive outcomes that come out of hospitals. You're there because you're sick, you're not doing well, you've either broken something, you've been somewhere, you're not feeling well, you can't get better. And so it's always a lot of lost ideas. And Brian, I think I take a lot like you do, is like, even when I go help and we take some of these patients home, I'm always usually super quiet, super nice with them. I always hold their hand, I talk to them. I want them to get that quality of care that I would want as being the nursing, because as we get older, that's, something that we might look forward towards, or might look towards, and and then how do we want to be treated as a patient? How can we give them the most dignity getting them home? And you're right. I mean, a lot of these people are coming home for their final there, and the family's happy to see them, and everybody's happy to see them. And at that point, you're a hero to the family because you've gotten them home. Especially when you have some of these difficult transports, like picking somebody up from Fairbanks and bringing them all the way to Anchorage because they couldn't fly, but they didn't have another way to do it. So here we spend 12 hours going up there and driving back with another patient just so they can get them back to Anchorage, or vice versa to Fairbanks. So I think that's one of the things that we really embraced, is going over the road system a little bit differently than some of our other competitors. Have just really given those options, because if it wasn't Life Flight, they weren't making it. They were really having a hard time. So I know that's been one of our staples, is going from here to Valdez to Tow to Homer to Kenai to Seward to the Valley. It's just like, we didn't. That's why I think one of the big reasons us getting the newer rigs is I want to make sure that we were going to get from point A to point B. Because some of these ones that you see the other ambulance, they have 250,000 miles on it. I'm like, do I feel safe that going to Valdez and back? In the middle of the winter.
Yeah, and I think that's one of the things I really enjoy working here about. A while ago, my son was in Arkansas Children's Hospital for a long time, way too long. But and what really struck me about that hospital was, everybody there was happy. All the employees were happy. And it just blew me away. I've been in hospitals all over the world. I've never seen staff that were just that happy and that really enjoyed working there. And one of the things that, so I asked my son's nurse, and I was like, why is everybody so happy here? Why do they like working here? And the thing he told me is, I went through nursing school and I did my clinicals here, and I went away and worked somewhere else. He said, but I came back. And I was like, okay, well, why did you come back? He said, because anything we need for patient care, we get. No questions asked. If it's for patient care and it directly affects patient care and it's for the betterment of the patients, we get that. He said, no place else I've ever worked has been that way. And it's a lot like that here, right? I tell Charlie, hey, what we need X, Y, and Z so we can do good patient care. Okay, just quiet. And and that's huge, right? Because the staff recognize that, right? And nothing is more disheartening as a pre-hospital provider to not have the tools and equipment you need to do the job, right? So, and you provide that, right? And again, that's huge in the EMS world. If you go to AFD and you talk to them, and sure, they've got a lot of stuff, but again, we talked about budget before, you may not be able to provide that piece of equipment for a couple of years, right? So we have that flexibility to be able to really make an impact on not only our staff but our patients.
Yes.
And that will continue to attract good providers in our company.
Sorry, go ahead.
I was going to say, something unique about private ambulance service versus like other revenue streams that we have is that you actually oversee the quarters, and people live there for like extensive time. And so I'm curious, is there any like particular leadership styles? Like, how do you handle, because it's a different scenario when people go home from the office and when they're like living together for 24-hour shifts. Like, how do you balance all of that and patient care and being this 24-hour system? It is.
So, because I've worked in that environment before, working 24-hour shifts, 40-hour shifts in the ambulance service, it's kind of like family, right? You don't always get along. You're in tight quarters for, from 2 to 30 days, right? So it's a challenge. It's really learning how to work with people, and keeping the peace can be a challenge at times, but it's one, getting to know them and being able to recognize personality traits, and those types of things to know how to work with all those different personalities. And we've got some unique personalities, just like every place else, you go to work. But we're such a small group that we really rely on each other. And so it is a challenge, and I don't think I ever do it great, but apparently I'm doing it well enough that we're able to maintain staff. So
and they seem to be happy, so that's good.
Having those unique situations up there, sometimes it does have some different challenges. You have some people that get a little bit burnt, or they have to switch partners for a little while, and we're all good with that. I mean, as long as we're maintaining the ALS care that we need to and all the BLS care that we're needing to, we're pretty flexible with it as long as it makes sense.
Yeah, and I think one of the biggest things is just treat people like people.
Sure.
Treat people good, and then I think at the end it usually works out for the betterment.
Yeah.
And then there are times when if you have somebody who's just not working out, then they're not working out, and then you need to just make that decision and part ways with them, right? It may not be that they're a bad person, they just may not be a right fit for our environment. So
And sometimes it's just a right fit right now, and they can come back at another time. We've had others who we've had to go, hey, you're like in this pattern of like almost torturing yourself. Like
right.
we can't be a part of this. Like we care about you too much to allow this pattern to continue. You're not happy, and we need to separate for now.
Yeah.
And we've had people come back, 2 years later with a total different life expectancy change, and their whole outlook on things is different, and they come back and they're a great employee,
And some of them have even been that moment where you just got real with me and held me accountable to what was going on, changed everything. It created a shift for me, and I had to look at things, and I had some time to think about it. And that in itself is I think accountability is how we show love around here.
It is. I think, one of the things I learned from the military is one of the worst things you can do for a unit is not hold members accountable, right? So that's the biggest degradation of morale in a unit is not having accountability, right? Because if one person's going to get away with something and the rest of the people are falling in line, then that just creates dissent amongst the unit, and you can't have that, especially in a small unit. It's the same thing here, right? If we have one person who's not being held accountable and they're doing their behavior is not conducive to the company's values, then
or goals, or policies,
then it's just going to degrade because it's easily noticeable, and then it becomes, well, they're doing it, why can't I do it, right? Or if they don't have to do it, why do I have to do it?
Yeah, there gets to be this resentment that happens. Yes.
Yeah, and we've seen our ups and downs with that. I mean, we've seen somebody that's been super great as they came in, and then sometimes they diminish or something else has gone on in their life and they had to, and we try to put them back on track. And if they work out and they get on track, then we get to keep them. If they don't, then we try to find a new position for them if we can, or they just don't work in our field anymore.
Yeah.
And I think we recognize it a little sooner now than trying to do the hopeful and say, hey, they're kind of coming around, but we should do it. I mean, literally, I think we're dialing our team in pretty good in knowing who their partners want to be and who they're going to be and who they want to work around. And, so we've had some definite changes going on. And we've had some long tenure for some of our EMTs. I mean, we've had some people join Anchorage Fire Department. We have people who have joined Wasilla EMS, and we've gotten them up to the next grade. And that was one of our missions, was to help people get to the next level they wanted to.
RAISEUP EMS as an overall position in the state. And that can look like many things, but one of it was creating a pipeline for people to understand what a standard run looks like, so that they can get some standards underneath them, and they're not just going blind as they apply for all these other positions.
Right.
A lot of people get these EMT positions, they have nowhere to go practice their skills.
Exactly.
And so now we present, something where they can, get 200 contacts within both crews working 24/7s, but they get lots of patient contacts, they get a lot of doctor time, they get a lot of nurse time, and they get a lot of vitals and just meeting with patients and seeing things differently. I think, Brian, so much than I was in 911 too, is seeing that we would come to a crash scene or come to the scene of a heart attack, whatever it was, into the bedroom or wherever else. And so you're trying to put the pieces together. Now picking them up from the hospital, we already got the backstory. Now we're trying to make sure that we keep them stable enough to get to their next appointment they're going to, or their home, or what's going on there. So it's a little bit different, but I almost feel like there's more work sometimes in the backside than there's the front side, because we're just trying to stabilize the patient, get him to the hospital, and usually we can get him anywhere within 10, 15 minutes.
Yeah.
We get to the hospital, we got 15, 20 minutes of loading the patient, getting them in the car, taking them to where they are, and then trying to figure out how we're going to get them back into their house. Because it might be full of obstacles, or there might not be anybody there to help us put them in there. And whenever we're at the 911, usually we have engines, we have extra people and extra rigs, and there's lots of people that can take part of venting, airway, C-spine, whatever else it is. But it seems like we are kind of like in our own, and we have to kind of take care of it from our own. So I love the different perspectives.
Yeah, and the ball of that is making sure you're taking them home to a safe environment.
Yes.
Right? Sometimes you're taking people home that.
Oh, you didn't even know.
No.
Yeah, no, you don't. How many times I've made phone calls calling Mondavi, and I'm like, hey, is this place, is this legit? Should this person go here? Because I felt really bad leaving this person there. They looked like they didn't want to be there. Yeah. And that's kind of a scary part, because how many ALFs do we have here in town? I remember at one time.
We have, when we were looking for our own family, there was almost 400, and that was 10 years ago. So I would imagine it's doubled or tripled.
Yeah, and we see a lot of them. And there's some great ones. I mean, you could just tell some people really do, and then you could really tell that there's some that we go to, you're like, ooh,
They don't have a process, or there's something going on that's just not quite as elevated as some of the others. When I was thinking about that comment of really we wanted to participate in raising up EMS for the state, there are some programs that we've been a part of for internship, and then also UAA. And can you just mention what that's about?
Yeah, so a couple of it is just the internal education, right, with our staff, and giving them the advanced education that they need through different partners throughout the state, whether that be UAA or the Alaska Pre-Hospital Education Consortium, to where they can get advanced classes with federal grants. The Department of Labor grants has been a big help to be able to get our employees the education that they need. And then, on the flip side of that is hosting people here locally to get them the patient contact hours. If they're not a part of an EMS agency, but if they're going through an EMS course, they still need the patient contact, right? It's one thing to do the book learning piece, but that actual hands-on patient contact is almost more important, right? And so I've opened our doors at any time if somebody wants to come and ride along with us and learn from our staff, then they're more than welcome, And we talked to State Forestry the other day, and they expressed a lot of interest in having their EMTs, because the EMTs at State Forestry, they go through the EMT class, and then they're firefighters, right? They're forest firefighters, wildland firefighters. And then I get a lot of patient contact hours. So I said, sure, we can host them, we can get them the patient contact hours. That helps us, and it helps them, and it helps us, in multiple ways, right? It gives our crews the ability to teach, right? Because I always felt that I learned more when I had to teach a subject.
Teaching right? is one way to learn, imprint it.
Yeah, because you have to be able to regurgitate what you know and relay it and communicate it in a way that somebody else can understand. And sometimes you may not know how to do it, but I've never really tried to teach somebody how to do it. You're not saying you do the see one, do one, teach one, right? But a lot of times it's just see one, do one. That teach one is a little bit harder. So they always say that if you can't do teach, and I don't always agree with that. I mean, there's some truth to that, but in our profession, there's something to be said for being able to teach somebody how to do the job.
Sure. Touch it, feel it, smell it.
Yeah.
Well, and I know we do have an agreement with UAA that in the past they've sent over students that were in the fire science or the EMS.
We just had two of them, didn't we? Hall and...
From APEC.
Oh, are they from APEC? Okay, yeah.
But, we appreciate, Brian, your contribution, and as we kind of continue to develop these new programs and kind of join together in this mission to keep doing our part in lifting up EMS in our area and fanning the flame for those people that want to join the industry, because this is not something that you just are I need to make money, I think I'm going to go be a medic. It's a calling, and people like feel it in their soul that they're here to do this job.
Yeah, I agree.
So,
Well, thank you, Brian.
well, thank you for joining us,
Yes.
and thank you everyone for tuning. Thank you everyone for tuning in. Do you have any last comments, Brian?
No, thank you for having me. It's been great so far.
Good. Well, I love having you.
Awesome.
All right.
Well, thank you so much. And remember, RaiseUpMindset.com if you want to check out our other episodes, and we'll see you next time.
Thank you.